Welcome back to the Recovery Channel. I'm Brian Ariel, Treatment Director of the Outpatient Recovery Program at Applied Care Services. Some people have a question of like, how do I know when I got a problem? Or how do I know I'm addicted? And that's a very good question that we spend a lot of time kind of trying to understand. There's people out there that know that they have a problem with substance use or behaviors. They know that it's causing problems in their daily lives. And then we have other people that they're oblivious. They don't feel like there's anything wrong, and this is just the way that they're coping through life and they're getting through life. It's similar to like, what's the difference between addiction and drug abuse? And sometimes we use those words interchangeably and we feel like it's the same thing. However, it's not, right? And you say, well, how do I know that? How do I understand that? Well, abuse is, well, we may use it for its unintended purposes. So we might abuse our medications if we're on medications, such as like taking more than what we should. That would be considered misuse and abuse. When we get to addiction, there's a pattern that is forming. There's a pattern of like, hey, you know what? I don't feel right unless I get high or drunk in the morning. First thing in the morning, I wake up and it's like, hey, here's a couple shots, or smoke a little weed, or do a line of heroin, or whatever it might be. In order for us to function, we have to be altered in some sort of way. That's where you might find that you're having a problem. Another time where you might realize that, you know, maybe drugs or behaviors even aren't a problem is like, say for instance, gambling. Right? Maybe we play the lottery so much that we can't pay our bills. Or maybe we go to the casino so many times that when we're done, we have nothing to show for it and we're behind on rent, or we can't buy groceries, or we can't provide for our family. That might be a problem. We might drink socially, but drink socially so much that no one wants us around because we become very disinhibited, and we might say exactly what's on our mind, and that might be offensive. We might find that we have to use more or take more than what we did before to feel a certain way. So for example, if one or two drinks in the evening, I'm relaxed, then it goes up to 4 or 5 drinks in the evening, and then we're talking about a 12-pack or a bottle. That shows an increase in that we're using this thing to cope with ourselves or cope with our problem. How do I know? Definitively, it would be calling and asking someone for help. Maybe we've had family members even come to us and say, hey, this thing that you're doing it's really, I think it's dangerous, or I think it's not really helping you. And we, you don't know what you're talking about. I've got this completely under control. I've heard that thousands of times. When we think we have something under control, or we think it's not a problem, and we tell ourselves, we sell this to ourselves that everything is fine, even though a lot of things are pointing to where it's not fine, I think we might have a problem. And you know what? It's okay to think about these things. It's okay to want to avoid them. And the thing is that they don't get better unless we do something in order to change what's happening in our lives. And that's why we have mental health therapists, and that's why we have treatment centers, and we have all these things to try to help people cope through difficult times. Whether they believe they're addicted or whether they believe they have mental health issues or not, it's just a point to where you can touch someone or reach out to someone and say, hey, listen, I think I might have a problem here. And that's the only way we'll really truly know for sure, is that we can seek some compassionate advice from someone that we trust, or maybe another professional, something like that. So I want to invite you, if you struggle with these things and you're not sure what's going on, you can always give us at Applied Care Services a call, and we can always sit down and meet with you and figure out what's going on. Sometimes it's a simple assessment, sometimes it's a simple office visit or a visit over Zoom by telehealth, just to kind of try to figure out what's going on and what might be the best approach for you. I want to encourage you to reach out, especially during the holidays. We all know how the holidays can be very tough on people. We miss people, we're dealing with added stress, finances, the whole gambit. I want to let you know that we're here ready to listen and learn together and to help each other. We're willing to come out and help you. Are you willing to reach out to us and ask us for help? I really hope so. And I hope to see you soon. Again, I hope that this finds you well. And this has been Brian with the Outpatient Recovery Program at Applied Care Services. See you later.